many different types of inhalers that can be used for the treatment of asthma or COPD. These three inhalers are called dry powder inhalers, or DPIs. This is called the AccuHaler. It contains medications such as Advair or fluticasone salmeterol. This is called the EasyHaler. It contains a medication called budesonide. And this medication is Symbicort or budesonide formoterol. It's called a turbohaler. So for the AccuHaler, in order to use this medication, first you need to open it, and there's a thumb part on the side. You can just slide it open, and that reveals the mouthpiece. However, when you first open it, the mouthpiece is not open. So the second thing you need to do is flip the lever on the side, and this will open up the mouthpiece and expose the medication that's inside. So as soon as you open up the medication, you want to make sure that you're not moving the inhaler too much, because that could cause you to lose some of the medication or dump some of the medication out. So when you're ready, you can push down on the lever to open up the mouthpiece, and then you want to breathe out to the side, and then bring it up, inhale very quickly and deeply, and then hold your breath for about 10 seconds to allow the medication to settle, and then you can finally breathe out. And then to check to make sure that you've gotten all the medication, you can certainly take another breath or repeat it without doing anything else. And then to check to make sure all the medication is gone, you can dump it out into your hand and see if there's any powder. If there is any powder, then the next time you use this medication, you want to make sure that you're breathing in very quickly and very deeply to ensure that all of the medication gets into your lungs. After you're done using the medication, you flip the medication closed like this, and after you hear the click, that means that the dose is reset and it's ready for the next dose. And then after you're done, you want to make sure that you rinse your mouth out with some water. And the reason for that is the medication here is a steroid, and that when that sits in your mouth, it could cause the risk of getting an infection called thrush. That's a fungal infection in the back of your throat that causes irritation and discomfort. And if you wash your mouth out after you're done using the medication, that helps to prevent it from happening. The second inhaler is called an EasyHaler. So to use this medication, it's very similar. You need to remove the cap, and then first shake it to make sure that the powder is loose, and then you need to click it once, and then again breathe out to the side, and then put it up to your mouth and breathe in very quickly and very deeply. Hold your breath for about 10 seconds, and then you can breathe out. And then again, to check to make sure that all the medication has gotten into your lungs, you can dump it out into your hand and check to see if there's any powder. And then, and then after you're done, you can put the cap back on. And then again, make sure that you're rinsing your mouth out with water after you're done to make sure you prevent thrush. The last medication, or inhaler, is called the turbohaler. So this one works. The first time you use this medication, you need to take off the cap, and you need to prime the inhaler before you use it. So what that means is the first time you get this medication, you need to twist it to the right and then back, and you'll hear a click. Then you need to do it one more time until you hear it click, and that means that the inhaler is primed. So now in order to use the medication, you need to twist it one more time. And now the dose is loaded and it is ready to use. When you're using this just on a day-to-day basis, after you've primed it for the first time, then you only need to do it once each time in order to load the next dose. Now, in order to use this medication, again, you breathe out to the side, bring it up to your mouth, and breathe in very deeply and very quickly. Hold your breath for 10 seconds, and then you can breathe out. And then for all of these inhalers, the best way to clean the inhaler is to take a damp cloth and to wipe it off just around the outside.